Good morning, everybody. I'm Dr. Joe Paul with Paul & Family Chiropractic and Wellness. This morning I'm going to give you 3 things to look for that might give you a tip-off that your back pain might be a little bit more than just a muscle spasm or something like that. We see a lot of disc injuries, intervertebral disc injuries in our practice, and there are usually 3 things that we see that point us to a disc injury. The first one is a patient reports during the history, typically, that they have pain with coughing or sneezing. What this does is when you cough or sneeze, pressure builds up in the spine and can cause a little bit of pressure on that nerve. So that, if you're having pain with coughing or sneezing, that may be a sign that there may be a disc injury present. The next thing is if you are sitting down and you straighten your right or your left leg and kind of lean forward over that leg. This is an orthopedic test called Bechterews, and also kind of points us to a disc injury if you have pain in your lower back. If you just have tight hamstrings when you do that, that's pretty common, nothing to worry about. But this is a sign that, for example, an orthopedic spine surgeon might use to say, okay, this looks like it might be a disc injury. Another way of kind of doing that test is laying on your back and having somebody lift your leg up. And if you have pain like before 45 degrees, that may be a sign that you might have a disc injury. The last thing is just what we call radicular pain that's going down your left or your right leg. A lot of patients describe this as sciatica. This can be from a disc herniation, a disc bulge, a disc injury. So it is something that you definitely want to look into a little bit more. That being said, not all disc injuries are severe to where they need a lot of medical intervention. Some of them will heal on their own. 3 things that you could do to help these heal, and usually you want to give it a good couple days or so if it's bearable, is the first thing is ice. Use ice, only ice, not heat. Heat will inflame it more. Ice will kind of take the pain levels down and also help with the inflammation. Usually the first week or so you only want to do ice, but that's a common mistake that we see. Patients will come in, they'll say, I went in the hot tub or I put heat on it and it felt good while I was in there, but later on it was a lot worse. So do not use heat. Next thing is move. Make sure that you're moving your body. Do not go and lay down. Laying down allows those tissues to shorten and just to get really stiff. Not good for a disc injury. You want to move it and nourish the spine, nourish the disc. That's going to help you recover faster. And the very last thing is keep good posture. Make sure that when you're sitting down, standing up, lifting things, that you're keeping a good curve in that lower back. That's protective of the tissues behind the spine and behind the disc, which are where the nerves are. So if you keep good posture, it'll prevent constant pressure into that nerve, which is going to reproduce your symptoms and your pain. If you know of anybody that has back pain, please forward this message to them, and I hope that this message serves you. If you have any questions, feel free to call our office at any time. Dr. Joe Paul, Wellness. Thank you.